So I'm just going to
Yeah.
share an element of my story to give some different context, I suppose, to the conference that you've had so far. So, as I said, I have experienced cancer as a wife, as a daughter, and as a patient myself. And the reason that I'm really passionate about sharing my experiences as a patient and a carer is to provide an insight that enables more considered care and understanding so that the patient feels seen and heard, and to actively empower themselves and their well-being through a diagnosis that will inevitably change their lives forever. So talking for myself, I suppose, how I saw myself after a cancer diagnosis and how a lot of other patients have also reflected back to me as well is that your life is never the same. It can enrich the quality of your life, the relationships around you, and also what you place value on. And it can also break you through the harshest of treatments and the toll that it takes on your physical and mental health. So cancer is a lot to deal with for you and your loved ones. And my experience within my community, coming from a South Asian background, is that it is a topic that we don't talk about. We don't want to invite it into our lives, so it's best not discussed. There is fear, shame, and stigma attached to a cancer diagnosis from the person going through it, but also their nearest and dearest. And often it's what holds people back from getting symptoms checked out early and from attending routine screenings. And often with the stats that are presented, it proves that people often present late and with a more dire diagnosis. So the reason I'm really vocal about being a very passionate patient advocate is to help remove some of that fear and the stigma, encouraging conversations in homes and in families, in friendship groups, in workplace, and providing representation to ultimately save lives. So I'm just going to share a few slides now and take you through my story. So as always, with everybody's story, with your own as well, life starts with you, but also it does end with you. And my story starts in 2013 with a breast cancer diagnosis at the age of 41, and it was a triple negative breast cancer. It was one that we hadn't seen coming. I wasn't attending regular screenings. Cancer wasn't something, like I said, that was spoken about within our family. I didn't know that I should be checking my breasts on a regular basis, but it was just by chance me finding a lump one evening in bed, sleeping in a slightly different position, that did alert me to something. I had been aware of it, but not to the extent, that I had had regular screenings. When I presented to my GP in the UK, again, nobody thought it was anything untoward. And so I wasn't actually sent for an urgent mammogram, but when I did go for a mammogram, I then had an ultrasound, I had a biopsy, and all of those already had set alarm bells going in my head that something was going on because, whilst I'd had a mammogram before, none of these procedures had gone on. When I was then diagnosed with triple negative breast cancer, I did go on to have a lumpectomy, adjuvant chemotherapy, 6 rounds of FEC, and 21 doses of daily radiotherapy. And I thought that would be the end of my cancer journey. And it was for a while, but it did also allow me to stop and put myself a little bit more front and center of my own life, and to recognize that maybe there were things in my life that weren't working the way I wanted to. And having met my mortality staring me in the face, I suppose, it did make me rethink and reevaluate quite a lot in my life. I then went on actually having supported my dad through, again, a late prostate cancer diagnosis to which he sadly died in 2019, then receiving an endometrial cancer diagnosis myself at the age of 48. So that again picked up, again, not through routine because we wouldn't have been checking for that, but something didn't feel right to me. And after having had the breast cancer diagnosis earlier, I suppose, any symptoms that were coming up at that age for me, people were putting down to menopause. But again, just having the confidence to push a little bit further and to ask for more tests led to an endometrial cancer diagnosis, which for me was lucky. It was at an early stage, and I had a hysterectomy and radiotherapy. And then again, I thought hopefully that was the end of my experience. But in 2022, I had a bowel cancer diagnosis at the age of 51. And again, that was picked up. I was actually pretty much dismissed or not taken seriously when I went to the GP with symptoms which I thought may have been related to COVID at that time, because I was very fatigued. And my mum had bowel cancer in 2013 as well, actually. That was picked up through routine screening when she turned 60. And at that point, nobody tested her for anything else. So I'd always had bowel cancer at the back of my mind, knowing that my mum had gone through it. So when routine bloods were taken at that point, and when they came back that I was anemic, that's when my GP asked me to do what in the UK we call a FIT test. And I had never had any traces of blood in my stools, but there was blood apparently. And so that diagnosis then also triggered, I suppose, a few alarm bells for people. I had never heard of Lynch syndrome before, but it just happened to come on my radar through a TV program, actually. And so at that point, I wasn't tested for it, but it was there at the back of my mind. And luckily for me, my paths crossed with a few scientists. So for those of you that are scientists on this call, thank you for everything that you do, because just through a routine conversation that I had with a scientist, she alerted me to the fact that she thought that especially with the endometrial cancer and now the bowel cancer, that she thought it was potentially Lynch syndrome, in which case she really recommended that I ask for immunotherapy. Now, immunotherapy isn't available readily on the NHS. But also I had been told at that point that my tumor was very close to my small bowel, so it was inoperable. So I didn't really have many choices at that stage. But luckily for me, somehow my oncologist managed to get me some immunotherapy on the NHS. And so I was treated with pembrolizumab. And for me, as a patient, I can honestly say the difference between having immunotherapy versus chemotherapy when I'd had the breast cancer were miles apart in terms of the tolerance, the impact on my body, and how I was able to actually live a fairly regular, normal life, whereas I wasn't able to do that when I'd had the chemotherapy. And so for me, the pembrolizumab was incredible. And whilst it did work really well, and it did shrink the tumor significantly, so that when my surgeon went in to do a bowel resection in 2023, what he said was that it had been reduced to the size of a walnut, where it had been a really quite significant tumor beforehand. So I was extremely lucky. I don't take any of that for granted in terms of how lucky I have been throughout all of these journeys. But the one thing that, I do consistently come back to is the feelings that appear through any cancer diagnosis are obviously fear first and foremost, but also what comes up for a lot of us as patients is guilt because you see the impact that it has on your family and friends, and it's your body that has, gone awry. And then there is shame attached to that as well. So whilst we can think of, especially as clinicians, we're looking at what we can do for the tumor, what I really want people to be aware of is all the emotional impact of a cancer diagnosis as well, and what it can do for a patient and what they're carrying, aside from, I suppose, the cancer itself. And what can happen at this stage as well is just how disconnected you feel from yourself, from your body. You feel very let down by what your body has presented. So you feel disconnected in so many ways, and you do lose this sense of control of your life and how things could turn out. So there's a lot that's happening from an emotional perspective, and I've always found the emotional side of a cancer diagnosis sometimes a lot harder to deal with than sometimes the physical impact of treatment and what that's doing for you. And I suppose what I really wanted to share with you all in terms of any exposure that you have to patients, I suppose, is just this opportunity to take the time to recognize that every patient, just like all of us, we're all unique and we all cope with things in a very different way. But recognizing that sometimes the science behind a diagnosis or the science behind what you are presenting isn't what the patient can absorb in that moment. There's only so much that they can take on board. So recognizing that without overwhelming them with the science part of it or the treatment options is to really ask them, what is it that they need in that moment? And having been the carer as well as the patient through all of these journeys that I've been on, the one thing that I can say is, having experienced the compassion and the kindness of some clinicians has made the whole experience of my cancer completely different, or even when I've been caring for somebody that's navigating that cancer. So just asking them, what is it that you need, can make a huge difference. But to feel understood, to recognize that we will all deal with it differently, but to give that person the chance to really stop and think about what is it that's going on for them. For me, especially at for the breast cancer, my fertility would obviously have been impacted, and I don't have children. And so there was but nobody really brought that to the table. Nobody brought that conversation. I had to bring that conversation. So I think it's really important that you think about what life stage is that person at, what's important to them right now, and how do we help them feel seen and understood as them. So, connection is extremely important in terms of how you make that person feel safe and seen. But underpinning all of that is trust, and how you build trust, or how you work with people within a consultation that can help build trust with a client, or not a client, a patient even, makes a huge difference as to how they tolerate the treatment as well. So it's really important that we think about the impact of trust. And so I suppose, whilst it does all start with me and my experience of a cancer diagnosis as an individual, allowing me to feel seen and heard, allowing me to be part of this consultation, as opposed to me being told this is the treatment that we're offering and it starts on this date and you're going to have this many cycles, makes a huge difference to how empowered I feel within this whole process. And so some of the things that I know that have been really helpful to me, and especially with the bowel cancer, was understanding what I could do with regards to my nutrition, so where I did have a sense of control. And what was disappointing for me was that the advice I was being given from the clinicians around my diet just didn't sit right with me, because I know there hasn't been enough research done on the impact of what we should be eating when we have an inoperable tumor. So there aren't enough stats there that I suppose my clinician could confidently present to me. So I had to go away as the patient and empower myself. And so I went and paid to have my own nutritionist who had experience of bowel cancer. And so with her, we worked on a diet plan, which meant I was having my fiber through soups. I was having organic, not so processed oats for breakfast and things, but I was really thinking about what I was eating. But those kinds of, I suppose, areas that we can feel empowered by, the importance of movement, all of these things really helped me feel like I was also taking control of my health and part of the journey. So like I said, whilst it all starts with me, it does also, end with me. And it is important that the two questions I would always ask clinicians to think about asking is, what matters to you and what do you need? And I think that then helps you feel like I said, that you're part of the whole experience. One thing that I am doing, as a result of the cancer, I have left my corporate job. I have now set up as a resilience coach, because I recognize the importance of us taking ownership of our lives before a cancer diagnosis. We all know the stats around cancer, but so many people aren't really living their lives fully, thinking that we're all going to be invincible. And so it's really important that we think about how we can do that now. but I am also leading a campaign around kindness versus cancer. And that was set up by a lady that sadly, died of her bowel cancer. But she had been really saddened by the lack of compassion and kindness that she'd had while she was experiencing her cancer. And again, that breaks my heart when you're going through something so tough to feel that you haven't had the compassion and the level of connection and the trust, and to support that patient in that way. But what I also recognised through doing research on this project is just the level of compassion fatigue that you as clinicians might be facing as well. And for me, it's really important to recognise, how do we work together to make sure that you have the support that you need for the work that you're doing, which is ultimately saving our lives, but also understanding, what it means for us as well to be on that journey together and to feel like we're doing it together. And I think ultimately for me, the one thing that I would really want is the opportunity to be the best version of me. And that enables me to feel like I am part of the whole diagnosis, the whole treatment plan, and then ultimately, I suppose, what happens afterwards. And that is my presentation.